Welcome back, everyone, to part 2 of our 15-part masterclass explainer series on 2025 telemedicine coding. I'm Harshal, and I am absolutely thrilled to have you back with us. In part 1, we laid the groundwork by unpacking the critical differences between synchronous modalities, those real-time live audio or video consults, and asynchronous modalities, like store and forward tech, where patient data is reviewed later. If you missed that one, definitely make a mental note to go back and check it out. But today we're shifting gears to what is arguably the single most critical compliance hurdle you're going to face in the new year. We're talking about locations. We're going to see exactly why getting the patient's and the provider's physical location right is the literal difference between a cleanly paid claim and a devastating audit recoupment in 2025.
Okay, let's dive into this roadmap for today. We'll be hitting 1. The high-stakes location hook. 2. Originating sites in 2025 timelines. 3. Distance sites in provider rules. 4. Audit vulnerabilities and pitfalls. And we'll wrap up with 5. Next steps for 2025.
Let's jump right into Section 1, the high-stakes location hook.
Look, the information we're about to cover isn't just dry administrative trivia. This is a critical financial shield for your medical practice. Seriously, ask yourself, what really stands between a successfully paid telehealth claim and a dreaded 2025 audit recoupment? Think about all the coding variables we juggle every single day. We've got modifiers, time documentation, medical decision-making. It's a lot. But which one of those is the absolute unquestionable deal breaker for telemedicine in the new year?
It's the exact locations of both the patient and the provider. Moving into 2025, location documentation is the non-negotiable difference between compliance success and an immediate audit flag. Payers want to know precisely where everyone was sitting when that medical service happened. Just imagine a very real nightmare scenario where a provider conducts a phenomenal, life-saving 45-minute consultation, but they simply forget to log that they were working from their home office instead of the main clinic. The result of that tiny oversight? A complete recoupment of funds months later. That innocent mistake is literally all it takes to trigger a massive financial loss.
Let's move to Section 2, Originating Sites and 2025 Timelines. Now, I need you to pay very close attention to these upcoming regulatory dates. But first, let's establish our baseline definition, straight from the source guidelines. An originating site is defined as the location where a patient gets physician or practitioner medical services through telehealth. If you're taking notes, I want you to highlight, circle, and underline the word patient here. Whenever you hear the phrase originating site, it always refers to the patient's physical whereabouts.
Now, what's really interesting here is how this ticking clock of compliance has evolved. Think back to pre-COVID times. Patients were strictly required to be at an originating site located in a specific, approved geographic location. Then, the public health emergency hit and changed the whole landscape. Right now, and through March 31st, 2025, those PHE telehealth flexibilities mean patients can receive telehealth wherever they happen to be. No geographic restrictions whatsoever. It's totally open. But listen carefully to that final cutoff date, because as of April 1st, 2025, those strict originating site requirements and geographic location restrictions are heavily reinstated.
However, and this is a huge however, there is a massive exception to that April 1st cutoff. For non-behavioral and non-mental telehealth services, yes, those strict geographic and site requirements come rushing back in full force. But for behavioral or mental telehealth, patients can continue to receive care wherever they are located. The patient's home remains a permanently permissible originating site for diagnosing, evaluating, or treating mental health disorders, substance abuse disorders, and, this is key, even for monthly ESRD-related clinical assessments. For these specific services, the location restrictions simply do not apply. Let's flip the coin and look at Section 3. Distance sites and provider rules.
We know where the patient sits, so now we have to look at the other side of the virtual screen. Let's define this term just as precisely. A distance site is the location where a physician or practitioner provides the telehealth service. Just like you linked originating directly to the patient, I need you to associate distance site exclusively with a healthcare provider's location.
So this is the dynamic we're always working with in telehealth billing. You've got the originating site, the patient's location, on one side, and the distance site, the provider's location, on the exact opposite side. Your daily documentation has to constantly marry these two locations together perfectly to create a compliant, rock-solid telehealth claim.
Which brings us to a massive piece of compliance relief for providers in the new year.
For calendar year 2025, distant site practitioners may continue to use their currently enrolled practice location instead of their personal home address when providing Medicare telehealth services from their home. This is fantastic news. It means providers can safely protect their personal home privacy while still remaining 100% compliant with Medicare billing regulations.
Moving right along to Section 4, Audit Vulnerabilities and Pitfalls.
For all the coders, billers, and auditors tuning in with us today, lean in, because this is the exact spot where mistakes happen and hard-earned revenue is lost. These are the 5 essential elements you absolutely must include in your telehealth documentation throughout 2025. Number 1, patient-informed consent. This has to be documented every single time, not just on the first visit. Number 2, the patient's exact location or originating site. Number 3, the provider's exact location, the distant site. Number 4, you must clearly state the type of equipment used. Was it synchronous audio-video or just audio only? And finally, number 5, total time spent. Missing even one, literally just one, of these details on a claim is going to trigger a red flag.
So let me be incredibly clear on this point. A missing patient or provider location in your documentation guarantees a failed audit, period. If an auditor reviews a record and cannot explicitly find where the patient was located, or they can't explicitly confirm the provider's distant site, the claim fails. It absolutely doesn't matter how brilliant or life-saving the medical decision-making was during that call. If the locations aren't properly documented, that money goes right back to the payer.
Finally, let's wrap up with Section 5, Next Steps for 2025. I know that was a heavy warning, but that's exactly why we're doing this prep work now. You are now equipped with the strict location rules and the critical timelines for originating and distant sites. But guess what? We're just getting started. Up next in Part 3 of this Masterclass Explainer, we are going to do a deep, microscopic dive into those 5 non-negotiable telehealth documentation elements we just previewed. We're going to look at the exact modifiers required, the strict time thresholds for specific codes, and the precise consent rules you need to fully bulletproof your coding. So make sure you're ready for it. I'll leave you with this question. Are your practice's EHR templates actually updated right now to capture these strict location details? Or are you currently sitting exposed to a 2025 audit recoupment? Think about it. Like this explainer, save it for your reference, and continue right on over to Part 3 so we can safeguard your practice's revenue. Thank you so much for joining me today, and as always, decode healthcare with Harshal.